BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
Good news for thousands of Canadians living with heart failure. Health specialist Leah Sarich joining us now, talking about a new medication, Leah, that could change the way patients are being treated.
Yeah, this is really exciting news for these heart patients because this is the first advance when it comes to heart failure in about 15 years.
Oh, wow.
So it's been a long time since they've seen any changes. So there are between 400 and 600,000 Canadians that are living with heart failure. So there's a lot of people in Canada with heart failure. So this is the chronic, long-term condition where the heart is just not functioning well enough to support people in their daily activities. So it's kind of a major deal. So either you have the heart is stiff, so it's not filling up properly with blood, or it's enlarged and it's not pumping the blood out through the body properly.
Yeah.
So this new medication that we're talking about applies to this group of patient that has systolic disease. So that's the one where it's not pumping the blood through the body properly. The drug is basically a combination of two medications, this sort of marriage of two medications. One that's already been on the market for a long time that's actually used to treat heart failure, and then the other one is a brand new drug that is brand new. So they've combined the two of them, and apparently it is a perfect marriage. So a big new study of over 8,000 patients was actually stopped early because it worked so well.
Oh, wow.
Yeah, so that does not happen very often. I spoke with a cardiologist specializing in heart failure here in Calgary about what this medication is going to mean for these patients.
We saw in the research study that if you qualified for the study, you experienced a 20% lower rate of death, hospitalization, and also experienced an improvement in symptoms and quality of life. So everything.
That's pretty good.
Yeah, exactly, right? So everything. So 20% reduction, death, hospitalization, and improvement in quality of life. That's as good as it gets.
No kidding.
That's right. So but it's really important to realize, however, that this medication is only for a certain set of these heart failure patients. So as I mentioned, it's for those who have the systolic heart failure, so that's where the blood is not being pumped through the body properly. And then of those patients, it's for those who are already tolerating the highest dose of the ACE inhibitor that they're already on. So that's a medication that heart failure patients are put on to lower blood pressure. So they already have to be able to tolerate that medication at its highest level.
Okay.
So Dr. Howlett says basically this new medication will be for about 20% of heart failure patients, but for those patients, it's going to make a huge difference in their lives.
Huge difference.
Yeah.
We always think medication, you think of side effects. Any side effects? Or?
So there's side effects with any medication.
Sure.
Let's be very clear about that. And in this case, the drug is very, very safe, but there are a couple of things that Dr. Howlett says he'll be watching out for.
Turns out this drug is very good at lowering blood pressure. It lowers the blood pressure more than the ACE inhibitor, as you might expect. Interestingly enough, unlike therapies that lower blood pressure a lot, there was no signal of kidney damage or kidney dysfunction that you typically get with a drug like that. We don't understand why yet. We're looking into it. But nevertheless, low blood pressure seems to be the main side effect.
So, of course, he'll be watching for the lower blood pressure becoming a problem. He'll also be watching for something called angioedema, and that's basically sort of an allergic reaction to the medication that causes swelling in the body. So those are the two things, but still, those side effects are quite rare, and generally the medication is quite safe for this group of patients. So it's early days. Health Canada hasn't even approved this yet, but they expect they'll probably do so within the year because the trial was so successful. It doesn't even have a name yet. It's got a number. It's called LCZ696.
Okay.
But the bottom line is that if you have heart failure, this is something to bring up with your doctor and
chat
say,
about it, yeah.
Exactly, have a conversation about this and
Do
say,
I
is this
qualify?
something that I should be looking into for me?
There you go. All this information will be on Leah's blog after we sign off today. That's good news for some people, that's for sure. 8:48.